Good evening, friends. Previous symptomatology we have seen about perception, and now today we are going to see about disorders of activity. So before going into the channel, I would request people to subscribe, like and share my video. Let's move on to the topic, that is activity. Okay, what an activity is? We function certain things, our daily activities. Okay, so when we talk about behavior in aspect with the activities, so there will be a change in the behavior of an activity. Okay, example, the person might tend to behave in such a way that the person might imitate others, okay, in terms of speech, in terms of act, or the person might do his activity repeated, the same activity will be repeated. Okay, so such sort of behavioral deviations that will come under the disorders of activity. Okay, now having known about what is the disorders of activity, let us learn how to examine the patient with a deviant behavior in the disorders of activity. Okay, number one, it can be classified into three forms. Okay, one is disactivity, uh, increased activity, or decreased activity. Okay, what is this increased activity? Example, a person who is purposeless, okay, who's more of agitated, the person will run up and down, and not knowing why he is walking up and down, he wants to achieve certain goal directed activity. Okay, but meaningless, the person will run up and down. Then the person, it is mainly because of person is getting agitated, feeling restless. Okay, so this happens in a person who's having suffering with the mania. Then it is called as increased activity or psychomotor agitation. Okay, when we say decreased activity, number two, it is seen in person who is always in a preoccupied status. Okay, for example, a person who is in a crisis or who has lost a loved one will be thinking the past events and the events that always make them to feel bad or being depressed. Okay, feeling very that is their life, they don't feel happiness in their life, they become helpless, worthless. In that case, the person might have a retardation called a psychomotor retardation. In case of decreased activity, they will not be able to do their own activities of daily living. In case of depression, okay, so when I say psychomotor agitation, the person with mania might have this psychomotor agitation, whereas in case of increased activity or psychomotor retardation, the depressed patient might have this. Okay, okay, now let us see what is the third thing is disactivity. Disactivity, please remember this mnemonics RC Vance. Okay, so what this R stands for? It is nothing but repetitive. Okay, repetitive is repeated. It can be a stereotypic. Okay, when you look into a mirror, whatever we do, the mirror also does. Then it is a stereotype. Okay, similarly, you can see your actions on the mirror. Okay, that is stereotype. So that is what we call it as a repetitive behavior. Okay, this repetitive behavior can be in the form of position, movement, or speech. Okay, I'll tell you what is stereotypic position. For example, a person, whenever we go to bed, will be lying down with a pillow. Okay, this is normally every individual will have. Even a person lying down, we will not feel comfortable when you're lying down on the bed if the pillow is not in a correct position. Okay, whereas in case of mental ill clients, with especially with the catatonic schizophrenia, the person assumes that there is a pillow and he lies down with his elevated head for a prolonged time. Okay, or the movement of eyes will be stayed for a longer period of time. Okay, so this type of positions will be maintained in case of catatonic schizophrenia. Okay, that is what is position, a repetitive position. Okay, next comes the movement. When I say movement, movement can be in the form of mannerisms or tics. Okay, I'll give you an example for mannerisms. people, when they take either a student or a teacher, whomever it is, they have that habit of rolling their chalk piece in your hand when they take a lecture classes. Okay, so this is what is a mannerisms. When I say tics, an example is like furrowing of head. Okay, so their eyebrows goes up like this is called as furrowing of head. Or they sometimes have the furrowing of the abdomen. They rotate their hands over the abdomen. This is a furrowing of abdomen. Okay, so these are the tics behavior. Sometimes they have the shaking of the shoulder like this. These are the tics behavior. Okay, right. Having known about what is mannerisms and what is tics in the repetitive behavior, we know what is in position, what is in the movements. Okay, let us know what happens in the speech. Okay, in the form of speech, they have the tendency of verbigeration and perseveration. Verbigeration is nothing but they will be repeating the words in a word form. Okay, say for example, mobile, 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 pen, 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 like that. If they repeatedly say, then it becomes stereotypic speech. Okay, whereas in case of perseveration, they'll have it in a phrase form. Okay, what is my name, what is my name, it is a phrase or a sentence form, then it is called as perseveration in a stereotypic form. Okay, right. So this is what we see in the repetitive behavior of a person. Okay, then second thing is compulsion. C stands for compulsion. What is that compulsion? It is in a form of an act. So something is compelling an client, that we have to understand. Okay, how does it have a or compulsion? We should understand what does it happens for a client. Okay, for example, my thought is telling me that my table is not clean. Okay, in that case, that thought tells me to do an act. What act? The act is, I am going to clean my table. This is normally what a person does. But for a normal, if the person having a deviant from normal behavior, then what happens is, they try to clean frequently. Even the table is clean also, they have that repetitive form of cleaning the table. Okay, their thought repeatedly tells them that the table is not clean. Okay, so it becomes a perfect nature of that individual and tries to see everything in a perfect manner. Okay, then it is called as compulsion. So when I say compulsion, it is an act. Repeatedly they tries to say for example, they keep on washing the clothes, or they keep on cleaning the room, like that. So that will be seen in obsessive compulsive disorder. Okay, so always checking, washing, cleaning, all these comes under the compulsive act. Okay, now coming on to the V and S. V stands for violence and S stands for suicide. Okay, now a person who is very aggressive, okay, some psychiatric emergency, very aggressive, then they try to exert some external force towards the others. Okay, then it is a violent behavior. Whereas if a person is having a suicidal behavior, then that same force, that external force will be towards that self. Okay, so they try to self harm. So, harming oneself, you call it as a suicide. A person who is very depressed, not able to come out of that particular problem. Okay, not taking any initiative to come out of that particular problem, and the person might think, for me only all these things happens. So if they have that low self-esteem, if they don't have that positive thoughts, then they go in for attempting or committing this suicide. Okay, harming oneself you called as a suicide, and harming others you called as a violence. Now we know what is repetitive behavior, then we know what is compulsive act, what is suicide, and what is violence. Next comes the automatism or automatic behavior. Okay, what is this automatic behavior? We can see in terms of act as well as in terms of speech. Okay, automatism, we have two things. I told you, act in the form of act and in form of speech. In form of act you call it as echopraxia, and in form of speech you call it as echolalia. Okay, praxia means it is an act. Okay, echo means there will be a imitation of an act. Okay, for example, a patient is standing, it's facing me. Okay, now I am asking the patient, come on, you come and sit. If in that case, if I'm showing my hand like that, the client also repeats the same thing how I am doing the action. Okay, the client also says, come on, sit. So there will be a imitation or imitating of a person. Okay, in terms of act, then it is called as echopraxia. Okay, and when you say echolalia, for example, I'm looking at my client and asking him, what is your name? So when I ask my client what is the name, if the client is normal, the clients will say my name is so and so. Okay, whereas if a person having suffering with echolalia, you can see the client will tend to ask the same question to me how I am asked. Okay, the client now asks the same question how I've asked, what is your name? Okay, now this is called as echolalia. Lalia is something, words, speech, okay, related to speech. Now we have to understand whether the client is having a form of echolalia or echopraxia. So these type of behavior will be seen in case of a type of schizophrenic patients. Okay, so now we have to, when we examine, we have to see whether the patient is imitating in terms of an act or in terms of a speech. Okay, so that is what we see in the automatic behavior. Okay, now we know what is repetitive, what is compulsive, what is suicide, what is violence, and what is automatic behavior. Okay, next comes the N, that is negativism. Now negativism is nothing but, you know, it is an whatever we say in a positive, the certain things what we tell the patient to do, the patient is going to oppose you. That is what is a negative behavior. Okay, for example, I am asking the patient to extend the hand. Okay, now the negative behavior will be the patient or the client will tend to flex the hand. Okay, so that type of behavior will be seen in case of the negativism. Okay, now this is what we see in the activities. Okay, when we examine the patient or assess the patient in terms of disorders of activity, these activities always we can examine, mostly these things have to be assessed for catatonic schizophrenia. This catatonic schizophrenia, it can be in terms of excitement catatonia or stuporous catatonia. Okay, now what are things that we have to examine in terms of activity? We have to see whether the patient is having a repetitive behavior of act or compulsive act or automatic behavior, or the patient is having a tendency of suicide or violence, or the patient is having a negative behavior. Okay, hope you enjoy. Thank you so much.